Hello, my friends, and welcome back to 15-Minute Free Thinking with your host, Joshua. You may have expected to hear Carpo. Of course, many of you already know my name is Joshua, but I go by Carpo because it was a nickname that was easy to remember that wasn't just another Josh. But I figure talking about mental health, I should introduce myself with my birth name. I went through a lot of shit when I was younger, and through my teen and young adult years. I suffered through some times of depression, some times of anxiety, and basically, as a Gen Xer, was kind of bridging the gap between the millennials and the boomers, if you will. I'm not one to go by generations, but there are definitely mindsets within different generations. And the boomer generation was stiff upper lip, toughen up, pull yourself up by your bootstraps, even though that's a misnomer because you cannot pull yourself up by your bootstraps. You always need help. You can sit down and pull up your boots. That's a different story. But what I want to talk about here is the major problem we have with fake diagnosis and illusions of illness on TikTok and YouTube and elsewhere. And there's a complete world built around fake illnesses, which one might call Munchausen Syndrome. I had to pop my notes back up there. I have a couple of notes about this because I definitely want to make this clear. I am not a psychologist or a psychiatrist. I am not diagnosing anyone's mental illness or lack thereof. And I realize a lot of people suffer from many different mental problems, and these issues need to be addressed by society, by all of us. We need to talk about it because many of us suffer from the same ailments. And surprisingly enough, you find that many of these ailments are easy to remedy if you just have a little bit of insight and a little bit of help from others. I've seen it firsthand. I'm not going to get into my personal experiences with myself or with others. But just to give you an example, I didn't even realize until about 3 or 4 years ago that I have my entire life suffered from a mild form of Tourette's syndrome. Now, when I see a person pretending to have Tourette's on TikTok or YouTube, and you can tell that the person's faking it, it's very difficult not to just want to scold the hell out of these people. Tourette's to me didn't even cross my mind. Like many other people, I just figured it was someone who just blurted out things. But I didn't realize it was actually tics and twitches, which I've had. I had the twitch of squeezing my eyes together. I used to lick my lips, which my friend, I remember calling me Lipstick Man. Good friend. No, he is actually good bro. But, we were kids. And I have had tics of twitching my head up and down. You name it. Back and forth. Different, if you have had these tics, T-I-C-S, they are very unique to each individual, but they tend to cross boundaries. We have the very similar tics, usually head-related or eye-related or mouth-making sounds, whatever it might be. The point is that it was slightly bothersome, but it wasn't so debilitating that I would sit there and create a TikTok or YouTube channel based around it to get sympathy. And this brings me to Munchausen Syndrome, which I have to address before I go any further in this podcast. And in order to read the paper that I have here, I printed out a little bit of something I wanted to share. I have to put on 2 separate pairs of glasses to get my magnification up to 2.5 because I printed it extremely tiny. Here's what it says about Munchausen Syndrome. Munchausen Syndrome, also known as factitious disorder, is a rare type of mental disorder in which a person fakes an illness. The person may lie about symptoms, make themselves appear sick, or make themselves purposefully unwell. This type of mental disorder is most often seen in young adults and is considered a type of self-harm. Side note here, when I was younger, we dealt with these issues differently And the fact that it says self-harm, I've also cut my skin when I was a teenager. We used to cut our shoulders and create scars, my friend and I. We didn't realize at the time that it was harmful. We didn't think anything of it. When I was 14 years old, 15 I guess, I was angry and frustrated, and I tattooed hate on my knuckles, which I have to this day, and I get many questions about that. And I left it because I want to remind myself of the fact that I just kind of made a mistake and I was angry, but I was mentally unstable at times in my life, just like many others are, but I got over it. And that's the thing. You don't have to be defined by your mental illness. So, moving forward, the rest of what I'm going to read it all the rest of it before I continue. It says, a person with Munchausen syndrome can be very convincing, which can result in doctors providing unnecessary treatment, such as medication or surgery. A person with Munchausen syndrome doesn't pretend to be ill for personal gain, such as prescription medications or money. Instead, the person is driven to behave the way they do for complex psychological reasons, including a strong desire for attention and sympathy. Often people with Munchausen syndrome have experienced childhood trauma. And I'll get back to that later. The second part says, symptoms of Munchausen syndrome. A person with Munchausen syndrome gains intense satisfaction from the attention associated with playing the ill patient. Signs and symptoms that may suggest Munchausen syndrome include 1. A spectacular medical history that includes many tests, medical procedures, and operations. 2. An odd collection of seemingly unrelated symptoms. 3. A lack of conclusive results despite intense medical investigations. 4. New symptoms that appear after medical tests prove negative. 5. Extensive medical knowledge in many different illnesses. 6. Frequently visiting many different doctors, sometimes in other states or territories. 7. Frequent presentation at emergency departments, usually at different hospitals. And the last one is 8. Requests for invasive medical procedures or surgeries. And that brings me to a very complicated part where I really should have provided a trigger warning at the beginning of this discussion, that I probably will be talking about the world of trans people as well, which I don't want anyone to be offended by this fact that I have no problem with anyone else's medical decisions or life decisions. But I do believe that we should really draw the line at talking to our kindergarten or third grade children who feel like a girl or a boy about whether or not they should take hormones. I mean, the question that this even exists, that prepubescent boys and girls are given the option to be whatever gender they feel like, to me is a slap in the face to all of society to say, are we really at this point? You know, that we think that it's normal to put a prepubescent kid on puberty blockers. I really feel strongly about this, and I know that might offend some people. This isn't about trans culture or trans people or your life decisions or how you feel inside. This is about the kids. And I remember when I was younger trying on my mom's clothes. I do. I remember putting on makeup for fun. And look, kids go through some weird shit when they're young, but we grow up and we decide who we are later. The human mind is fragile, and it can be easily corrupted by horrible parents who just egg on their kids in order for attention's sake, because I don't think that it's normal to put kids on medication that changes their gender when they're young. And I wanted to get that out of the way. And there's a few other issues before I get into the TikTok bipolar and dissociative identity disorder. First off, let's start with fat phobia. I've heard this term a lot lately, and And I saw a couple TikTok videos earlier somebody was sharing because they were just incredulous. They were just couldn't believe that people believed this and thought this way. It was about, see, fat phobia is, some people believe it's a fear of fat people, which seems to me to be kind of ridiculous. What it is a fear of unhealthy people and a fear of our own mortality, to get right down to the basics. Because when we see heart disease walking around, it's the same as when we're walking down the street and we see somebody who is addicted to heroin on the side of the road. And you say, wow, I'm glad I'm not like that. And a person might say, well, you're heroin shaming or drug addict shaming. I know that might sound like a horrible comparison, but it's not. They're not the same thing, but they're both things that we deal with as human beings. That we know that being overweight causes more heart disease and more damage to the body, and people who are overweight have shorter lives. And that's just fact. These things can be researched and looked at. And I'm not trying to fat shame here. I'm bringing up the fact that being fat is unhealthy. It doesn't mean that fat people are bad. Just like it doesn't mean drug addicts are bad. I've had my bouts with drugs, okay? So I know how shitty I feel inside. I would never say somebody's drug shaming. I might get offended because somebody tells me how to live my life, and that's different. I'm not telling anyone how to live their life, but the reason why I think this is crucial is because a lot of young people are being told now that being fat is healthy, that being fat is fit, and that's just not true. It's just not true. We weren't brought up to be healthy in my generation, to just be thrown in our face that it doesn't matter anymore. We're treading too lightly. So while I have a lot of empathy and sympathy for the people who have suffered from addictions and from disorders and from afflictions like Tourette's or, OCD or ADD, also, we can't take it as a fucking victim. We really can't. We have to take it and get over it and be able to beat it. Because instead of looking at mental illness as something to be conquered, now we're looking at it as something to get sympathy about. Now it's funny because I do understand that we want to overcome these things. And a lot of us have seen a lot of progress in that field, because when I was younger, there was still a stigma on mental health. But when that stigma was lifted, instead of getting help for those who need it, we've created more people with mental health issues. And I didn't want to believe that. I wanted to believe that it was just, because a lot of folks might say, no, it's just that, we're able to identify more people who have these issues now. I thought that too, and I don't believe it any longer. I really believe that people are creating the illusion that they're sicker than they are, and TikTok is especially bad with this. Self-diagnosis, there are people, I believe one girl I saw who claimed to have 270 personalities because she had DID, which has become the new buzzword for basically look at me. People get attention, and that's what Munchausen's is all about. So DID is dissociative identity disorder, and this also does relate to the trans community, and people don't want to talk about that, and I understand that. But not knowing who you are, I want to tell you something. I didn't know who the fuck I was when I was a kid. Hell, when I was in 7th grade, I had a mullet. And I wore baggy MC Hammer pants that were neon with that had cuffs that were tight around my ankles, with white socks and sandals. I fucking tried to figure out who I was. I became a metalhead, a skateboarder. I was into all kinds of different things. And in the end, I realized that finding yourself is a lifelong process. And so this is important to me to acknowledge this before I forget, that the younger generations, they want everything right now. They're used to quick videos and quick quips that will tell them everything they want. They want life hacks to everything. Well, guess what? You're going to have to work that out over a period of time. And this is why people start to see that the old ways, if you want to call them that, of silence and meditation and contemplation are being completely overlooked. We're living in a fast-paced society right now. So if you can say you have DID, then you can say you have alters. Now, some of these, in order for me to explain this, it would take all day long. But you'd have to watch the videos yourself, and I'm sure many of you have seen the videos exposing these people. But these are people on TikTok who claim to have multiple personality disorder, but they will all of a sudden just switch to their alter. And it's almost like on cue. And then they know everything that's going on still. That's just not how it works. These people are faking it most of the time. And therefore, the few people who actually have this, which they say could be like 0.01% to 0.1%, are most of the people who really have this condition, first off, aren't going to be posting it on Instagram for likes and attention. They're going to be embarrassed about it. They're going to feel awkward. These people switch alters and they act like into, oh, I'm a different person now. And others are like, oh man, that must be so crazy. And then they start watching it and following it. And the next thing you know, you've got a whole bunch of viewers and you think, I've got to keep this up. You keep developing this whole persona and creating this idea that you're sick, that you have an illness. And it's bullshit. It is, because the people who truly suffer from this are probably embarrassed as hell by the fact that these people are doing this shit. I called it the other day WebMD for millennials. The early days of the internet, when WebMD became a thing, I remember looking up some symptoms that I had and getting all worried. And then years later, I never used it again. I was like, I got cancer, and then now there's a meme, been a meme for years about that shit. Like, never look up any symptoms on the internet, because then you'll think that you have something you don't. Most of the time, a pain is just a pain, and it goes away. You can't self-diagnose like this, and it's especially complicated when you have no physical pain, but only mental anguish, because we all have some mental anguish. And so if we can just throw in all these acronyms, and OCD, and ADD, and DID, and BPD, and say, this is who I am, then it allows a lot of people to escape scrutiny and escape criticism, and most of all, the thing I've realized is escape responsibility. To actually do something with your life, to be a person who goes out and interacts with others, who provides and works and does things for yourself. Instead, a lot of people fall back on the crutch of, I'm sick. And it sucks, because talking about this, I realize that a lot of people really are sick, and I also realize that a lot of the people who even pretend to be sick, they're still sick. I want to make that very clear. I'm not berating these people. I guess I'm telling sane people not to fall for it. There are some of them who are sociopaths who basically just do it for the money, or, the clicks, so they can get revenue. They'll set up GoFundMes and fake deaths of people in their family. I mean, people really have no limits these days as to how low they'll go, but that's not the biggest issue. I think the biggest issue is the tragedy that it's trendy to have a mental illness now. And it's not normal. Some folks will say that it's because, of society, what it's doing to people. And I thought that too, but then you look at the numbers, it's just not. You're going to tell me that, people with, multiple personalities has doubled or tripled in the last year or two? No, of course not. They see something that attracts them and they fall for it and they claim, I must have that. Because, well, I get angry sometimes, and sometimes I'm happy, sometimes I'm sad. Well, I must have multiple personalities. And yeah, welcome to the real world, you do. And people are too young to realize that this is just normal life. Anxiety is not a trendy thing to have. I had anxiety really bad in my 30s. True anxiety, butterflies in my stomach. I dealt with it. I created a mental reality for myself where I could get away from that shit. And other people need to as well. We need to take responsibility. And so it's not trendy to have mental illness. And just because you see that other people say they're gender fluid doesn't mean you're gender fluid too. Just because you see people that say that they have this, OCD or ADD just because they can't focus for a while doesn't mean you do too. People are all different. If we're doing what we do to educate people, that's fine. If we're doing what we do for attention, I think that that's when it's a problem. And a lot of these are not real disorders. My sons hear this shit. I have a 9-year-old and a 12-year-old that are still impressionable. That my older son is 27 and 28. Fortunately, he can see through the shit, but it took him a while too. My kids that are growing up in the world of, 9 and 12, they have to hear this crap all the time, Well, I had to pause the video for a second because my dog wandered out of the house, and then I accidentally turned off the voice recorder, which totally screwed up my podcast. But hey, that's okay. I won't get all enraged about it. Wait, will I? No. Okay, so my point here, and what I really wanted to get to, I guess, was, that it's not trendy to have a mental illness. And, well, let me just rephrase that. It is trendy to have a mental illness, and it should not be. It's not something that we should gawk at. And we live in a society where people watch on, TLC, the 900-pound sisters, where these two extremely, extremely fat ladies try to live their lives, and people watch and gawk at it. I can't remember what it's called or what channel, but it's ridiculous. We live in a time where we are constantly rubbernecking at other people's misfortunes and illnesses, and the fact that people get attention for these things means that other people want to become these people, and we're normalizing things that are not normal. We are making human beings into like this optional, well, whatever, you can be whatever you want. Hey, you want to identify as a lion or a fucking donkey, go for it. I don't care what people do with their lives, but the fact that it's become kind of center stage with what a lot of people are talking about, I think that this is an issue, and I think that it's a problem because when you're young, you're going through a lot of shit, and what you need is parents to tell you, yeah, you'll move past that, because we do. We move past the shit. Not everyone, but a majority of kids do. There are a lot of weird things going on right now in society, and I feel like we're forgetting the main point, which is you have to create yourself, God damn it. You have to create your own personality. You have to do something for yourself. Make your own fucking nickname. Do something with your life. Be acknowledged. I'm not talking about making money, being rich or famous, any of that shit. Do what makes you happy and make sure that it works. You're going to have hard times. Sometimes you'll be depressed and down. It's not something you complain about and, get attention-seeking behavior for. We have to learn that when you have problems, it's okay to ask for help. But don't put on some bullshit act online, like you're sick or you have an illness that you don't. Because the people who really do have to hear that shit and just cringe. And they're not the ones out bragging about how sick they are, There was a dancing plague in, 1512 or some shit. I remember reading about this where a few people started dancing in the streets, and pretty soon there were like 100 people out there dancing for weeks on end. People got exhaustion and had to go to the hospital and stuff. I don't know if anyone really died. I think like one person maybe, but it was like this. Basically, things are contagious. Ideas are contagious to humans, and it's difficult to explain why and how. But maybe they just saw people out in the street dancing, and in the back of their mind they were bored and they just wanted to join in, and they couldn't stop themselves. I don't know the reasons. It's weird. We are all fucking mental patients. All of us. We all have some problems. And so there really isn't much of a stigma on mental health anymore by the general society. Basically, we know that we all are fucked up. And it just adds more stigma to pretend like people are ill when they're not. Hey, get BetterHelp. By the way, this is sponsored by BetterHelp. I'm kidding, totally kidding. This is not sponsored. This podcast is not sponsored by anyone. But I want to make this point that almost every single self-help video that I've seen any time in the last several months has been sponsored by this site called BetterHelp. And I looked into this because I was curious. Where you can go and you can get, help and diagnosis. Like all the mental health videos are sponsored by BetterHelp, where you're supposed to call and have a counselor that can help you through your shit. And I just want to call that shit out and say it's crap. From what I've read, people get turned down because they don't want anything too complicated or where they might be liable. They just have these people who want to try to give you advice for a certain amount of money, and It's just bullshit. It's really bullshit. We're living in a kind of a really, it's almost like going to confession. You know, the priest just pushes you through Hail Marys and, you know, nobody really gives a shit. You need to find somebody in your life who gives a shit about you personally and talk to that person. Unfortunately, we often don't want to because we're afraid to talk to our own parents, our own kids, our own sisters, brothers, cousins, friends, whatever it might be, about how we really feel. And that's why I've made it a point in my life to be overly honest with people, which has cost me some relationships, but has kept me sane. Because I don't put up with certain things, and I don't put up with bullshit. I don't put up with any type of, like, you know, scapegoating or victim blaming. This kind of, it's just, I look at things through a real lens as much as I can. And that's my perspective, not anyone else's. So, I just want to say anxiety sucks and depression sucks, but they both tell us something about ourselves. It means we need to do something differently. Usually anxiety means that we need to get something achieved. And we can improve the way that we see the world. We can improve the way we see ourselves. And I think that when kids get caught up in just sitting there on their phones looking at TikTok, and they see these other kids who are getting all these hearts and love because they're pretending to be sick, it's sad. And I want to leave it on this note. I'm not angry, and I'm not scathing these people. I'm sad that so many kids fall for this, and adults, that they think that they're sick too. But mostly kids, because they're the most likely to be affected by these, you know, types of videos. They see other kids who are the same age as them that are suffering from what they think they have, and then all of a sudden they start resonating with that. The TikTok algorithm is so specific that if you watch a couple videos on disorders like that, you will just get flooded and inundated with it. I mean, it's one of the most aggressive algorithms from what I've read, and it wants to push you into the same bullshit. And TikTok is very low effort, low energy. You know, it takes nothing to make a TikTok video. They're so short. Because of this, people can pump out this bullshit self-help guru crap, whether it's doctors, whether it's, you know, other people trying to give you expert advice, and you find out that they're not all they say they are. And maybe you've just fallen for somebody else's idea of who you are instead of developing who you are and creating a self for yourself. We want to identify with the group and say, I'm one of these people, or one of these people, or no, this is my condition, or this is my condition. Not realizing that we all have a little bit of ADD. We all have a little bit of OCD. We all have mild Tourette's at times. That we all suffer from all kinds of emotional disorders that we don't acknowledge as individuals because they don't affect our lives to the degree they do some people. But they're there. They're all there. There's no such thing as normal. There's no such thing as I have it figured out and you don't. It's, we all live in a different world, and we're doing our best to cope with that. So I would just like to see people really acknowledge that hiding behind a mental disorder is not appropriate. If it's not a real mental disorder, especially, but even if it is, using it to get sympathy is not healthy. What we need to be doing is using it to educate people and to let folks know that they might have similar things. If you twitch your head, you know, and you do weird eye blinks and stuff like that, maybe you have mild Tourette's. Does it matter? No. Do you need to complain about it all the time and base your entire existence off of identifying with this illness? No. And maybe that sounds harsh, but find something else. Don't be proud or identify with something that is out of your control. Create something you can be proud of that is within your control. And that's just how I feel as a stubborn old Gen X 47-year-old man. Cis male that, you know, does believe in normalcy out there, that still believes that there are genders, that still believes that there are, you know, that there are rare medical conditions where people have certain OCD or ADD, and a lot of people use it as just kind of a way to fit in. And I don't know what to do about it. I don't know how to deal with the future that we have to face. Other than me as a small-time YouTuber / podcaster who wants to talk about the topic, and will probably get a bunch of heat for bringing up some of the topics I did, and I don't care, because honesty to me is all that matters. Having the integrity to speak up on these things is important. And a lot of people are finally waking up to the fact that nobody is immune to criticism. And we just have to deal with that. That's to our benefit. So thanks for listening. I'll talk to you all next time. If you're listening to the podcast, be sure to check this out on my other channel, Carpo's Complaints. And that's on YouTube. I also have another channel, Carpo719, which is my basically philosophy channel. Then I have Carpo Craft Guitars on Instagram, where I have my woodworking and I build guitars as well. And my Patreon, if you would like to donate, is Carpo719 as usual. And of course, this is the 15-minute Free Thinking Podcast, which is also available for free on all platforms. So if you want to donate even $1 a month to my Patreon, you'll get access to my psychedelic videos, as well as my various topics that I have about controversial things that I don't want to keep available on YouTube. Peace out.